Hello friends, today I am going to talk about MRI scans. MRI stands for magnetic resonance imaging. So this is a very advanced imaging modality and we are routinely using this for our spine, knee, shoulder patients, and there are a lot of misunderstandings and preconceptions about MRIs. So this video is to clear some of those misunderstandings. So number one thing, MRI is magnetic resonance imaging. In this, magnetic waves are used to image various parts of your body with extreme clarity. So no amount of radiation is involved. This type of scan is safe even if you are pregnant or if you have any heart problem. Yes, sometimes if you have an implant or if you have a pacemaker, this scan is not possible because of the magnetic field involved. Nowadays, a lot of implants are coming in MRI compatible materials which are non-magnetic. So whenever you are undergoing some sort of implant or some sort of pacemaker, please confirm with your healthcare provider that this is MRI safe or MRI compatible. Now coming to the second part, why is an MRI scan needed? So a lot of times patients are reluctant to go ahead for MRI because of multiple reasons. It is a longer process, it takes around 30 to 45 minutes for an MRI scan. Secondly, the cost involved is a bit higher and patients are sometimes unable to lie still for such a long time for undergoing the MRI. So why is an MRI so important? So normally for any sort of problem, first thing usually we used to do an X-ray. In an X-ray we can only see the bones. But if the problem is not a bony problem, if the problem is in the cartilage or in the disc in between the spine or in the nerves or in the soft tissue, which is not seen on an X-ray, an MRI is needed to see all these structures clearly so that we know the exact level of the problem and we can plan the further treatment. Now thirdly, what is the process of an MRI? So an MRI machine is an enclosed cylinder through which the patient has to go in and he has to remain inside for a variable period of time which may range from say 20 minutes to about an hour. During this time, when the MRI scan is being done, the patient is required to lie with utmost stillness. He has to be absolutely not moving. So that gives better picture quality, better clarity if the patient is still. A lot of time patients are anxious because the magnetic waves, the sound is continuously coming and it's an enclosed space, so it can lead to claustrophobic feelings and also sometimes due to pain the patient is not able to lie still. So there is a provision where an MRI scan can be done under anesthesia. A qualified anesthesiologist is there with you inside the MRI room who is giving you some sort of sedation, some pain relief and ensuring that you're comfortable. So this is a very safe modality and a very useful one to know your exact problem and to plan for treatment. For any more queries, you can ask us in the comment section.